Hi, this is Kristen Digwood from Elite Pelvic Rehab, and I'm jumping on today to talk about some simple things you could do to reduce chronic pain. So by chronic pain, I mean that pain has been ongoing. There's a big difference between if you fall today and break your hip, what you do, versus if you've had ongoing pain for a very long time and it just doesn't seem to go away, or if it comes and goes, you have good days, you have bad days. A lot of people say, I don't even know what I did yesterday. I was feeling good and now the pain is back. And it could be a very frustrating, very anxiety-producing thing for people. When we look at chronic pain, some of the research that has been done over the last few years recognizes that you could have this pain even in the absence of tissue damage. So you broke that hip, you went, maybe you had surgery, you went through your rehab. When they look at the hip again, everything is healed well, yet you're still having that kind of pain. That's what we're talking about when we talk about chronic pain. And why does that happen? There's really nothing anymore to quote unquote fix in the area. You don't need another surgery. There's nothing else that's going wrong, yet you have this kind of pain. I see this a lot in the pelvic rehab world that I spend most of my time in. People will have pain issues where they go to the doctor and nothing is found. Insist I must have an infection. There must be something wrong. They'll have MRIs, they'll have CAT scans, they'll go time and time again to all different medical professionals. And after a while, negative findings on these tests become quite frustrating to people. The question that everybody has is, why does that happen and why is it ongoing? I'll attach into the bottom of the video or into a different post an article that I had written a while back on the pain theory that kind of explains a little bit why this happens. Your neural pathways have a memory, and when they go through painful situations, what could happen is that over time they are just much more sensitive. So when you get this kind of pain, it doesn't necessarily mean my tissues are damaged or it's alerting me into something is medically wrong, my tissues are damaged. It's that the pathways need to be retrained to recognize what is an actual emergent situation with the tissues and what is just something going wrong in the pathways. We have, as human beings, we kind of remember negative events much more than positive events. So for instance, if you got your hair cut, you walk out and maybe, 15 of your friends say, oh my gosh, that looks wonderful. Well, that's a great haircut on you. And if one person says, I'm not really like the way that shapes your face, or why did you go so short? What you'll remember most likely is that one negative event, and that'll play in your head over and over and over. That's a little bit like negative events in your body. So how do we jump in and how do we stop that from happening? Your body and muscles and joints, they take well to motion. So one of the things we do in therapy is exercise. We do a lot of things to kind of down-regulate these pain problems. But one of the things you can do now when you're home and none of us are really allowed to go out anywhere is very simple motions that are non-threatening. So if you have pelvic pain and you're somebody who falls into this chronic pain category or low back pain, very simple, non-threatening, repetitive motions done it mindfully, meaning you don't just do them and not think about them. The more that you can set a couple minutes aside to do them, the better off the memory in your neural system is. So one thing that I do a lot with patients who have this problem is exercise, and it could be as simple as this. I'm going to regret doing these things on film, but I'm going to do it anyway for you guys. Very, very easy. I'll tip my camera because I'm a little bit oddly tall. I never really find pants that fit well, but that's a different video. When you're standing, you could be standing, getting ready to brush your teeth, or on the phone, talking to somebody. Just a nice, simple, easy motions, kind of like you're twirling, a little bit like you're doing a hula hoop, but add a nice, slow, controlled, I say pain-free range, if that's impossible, if you just always have pain. Don't really take it over a 3 out of 10 on the pain scale. Just nice and easy so that your body starts creating a new memory, a memory that motion is good and it's not harmful. Sometimes people can even just do very small squats. You'll feel your pelvis kind of go back and forward. Just a nice, easy motion. This triggers off the nervous system to realize that movement's not bad, movement is good, movement's not harmful, and it starts getting into your pathways and making them feel a little less threatened by simple, easy movements. Movement is good for all tissues, it's good for flexibility, it's good for blood flow, and it's also great for those nerves that just get irritated from time to time. So try this out. It's recommended for people who are really having flare-ups or issues with nerves to 4 to 6 times a day just do something to down-regulate those nerves, and this is one of those things. So you don't have to do a whole lot of time of it, maybe just a couple minutes set aside, maybe right before you brush your teeth and right after you brush your teeth. You can fit these into your day and start controlling those pathways and get that chronic pain to reduce. Again, I will put a link on to the article I'd written in the past so that you can go in and learn a little bit more about the pain theory. If you have any questions, reach out to me. Feel free to send me a message. I'm on Facebook, I'm on LinkedIn, I will post my email address. Anybody who needs any extra help with this, feel free to drop me a message and I can jump on to FaceTime with you and help you out. So let me know what you think. Thank you so much.